So why do seasonal allergies act up in springtime? It's a big problem for a lot of people, particularly tree pollen allergic patients. Trees pollinate starting really about early March, and this is a continual source of typical symptoms of allergy like itchy eyes, runny nose, and sneezing, which is all basically the end product of inflammatory mediators, as we call them, little tiny molecules inside the lining of the nose that are brought there by the immune system. There's a branch of the immune system devoted to allergy, and it responds to often preformed antibodies that we have to things that we're allergic to. And when those mast cells get degranulate, they are the quarterbacks of the allergic branch of the immune system, they basically dump all of their contents into the bloodstream, a lot of which is histamine. That causes swelling, and then you're on to a lot of irritation and difficulty breathing and all the runny nose that comes along with it. So these are kind of some of the basics of why allergy acts up at this time of year. Right on the heels of that is grass pollen, which comes early in May and June, and if you're allergic to grass pollens as well, you'll have symptoms then. And on the heels of that are weed pollination periods. So ragweed and the like in late summer into September. And then after that, mostly the airborne molds that come from dead leaves and the like. And then there's perennial allergens, so they're year-round: dust mite, cat and dog dander, all kinds of other less common ones, but those are some of the more common things people are allergic to and why. So sinus headache is a common overlap symptom of migraine. It's often a trigger for migraine, in fact, because the gate theory of pain tells us that if you have increased pain, you're going to trigger more migraine, because migraine is often triggered by other sources of pain. Most notably the trigeminal nerve. That's the nerve that is sensory to all of your sinuses and all of your face on each side. And if there's a lot of irritation inside the lining of the nose, that's going to, in turn, often trigger the entire downward spiral of migraines that people often get. If they get an aura, they might have bright lights bothering them, then loud sounds, then nausea or vomiting, and then the headache may come. If they don't have an aura, they may get all those headache symptoms immediately at the onset. Obviously, sinusitis, if it's better controlled, does a better job of avoiding that entire trigger system. So we want to get the allergies under control, like itchy eyes, runny nose, and sneezing, often with the use of a nasal steroid or an antihistamine. And then if that hasn't worked, then immunotherapy. That's something that we give as a result of allergy testing, either through skin testing or lab testing. Then the other issue is that sometimes the ear pressure and vestibular migraine symptoms can sometimes cause problems for people. So they may have a migraine variant where they don't actually get headache more, they get spinning attacks, which are episodic, a lot like migraine can be. And those have often issues relating to the inner ear, such as Meniere's disease, a disease of extra pressure in the ears, ringing, hearing loss, or spinning attacks, which happens often in middle-aged women. And that disease often has a lot of overlap with vestibular migraine. So there's a few areas where ear, nose, and throat complaints interface with migraine, and those are two of the more common ones. What can you do to avoid peak pollen times and indoor allergens? Watching your pollination counts, there's a lot of good websites that can get you that information so you can know that there's a high pollen count happening. That is best treated with symptom control, like a nasal steroid or an antihistamine. And then if those have failed, sometimes we can give prescribed medications, but more often than not, we're going to think about immunotherapy. And of course, if you own a dog or cat, most likely you're going to fire your allergist rather than get rid of your dog or cat, but you can certainly cut down the amount of debris around your home by regular vacuuming and cleaning of the floor spaces where those types of dander can build up. Dust mite avoidance starts with hypoallergenic mattress and pillow cover. Next in line would be getting a HEPA filter for your bedroom. And if there's carpet in the bedroom, thinking about pulling that carpet, and certainly do a lot even just by vacuuming twice a week in the bedroom. So when is it reasonable to see an allergy specialist or an ear, nose, and throat doctor? Like, I am board certified in both of those things. The main purpose and benefit is going to be derived if you are not benefiting from the things available to you over the counter. So the starting point is often with a nasal steroid spray. like common ones would be Flonase, Nasacort, Nasonex. These are available over the counter, and if you're not contraindicated from taking those because of a deviated septum or history of nosebleeds or nasal ulcers or glaucoma, those would be reasons why you would not want to take those medications. But if you're presuming that you are able to tolerate those things and your pharmacist has guided you there, 2 sprays each nostril once a day is a good starting point of that, and then you would just take that for a period of at least a month to know if that's going to help you. And if that hasn't worked, and an antihistamine to supplement bad days hasn't worked, then it's maybe time to think about getting an opinion from an allergy specialist, and certainly your primary care provider can refer you our way if you're interested in being seen here.